Hi everyone, Drew here from Navina Thai Yoga Therapy, and today I wanted to talk to you about Thai massage and scoliosis and the work that we can do with patients who have scoliosis. The first thing that we want to consider is which type of scoliosis our patient has, and of course we need to outsource that diagnosis to other medical professionals. But for example, there is structural scoliosis, in which instance we actually can't have much of a significant impact other than relieving the tension and discomfort that people are feeling due to those muscular imbalances that result from having structural scoliosis. Functional scoliosis, on the other hand, is something that we can really have a positive effect on, and that's generally caused by things like imbalanced strength in the body. So if we think of elite athletes or people who use one side of their body more than the other and don't balance it out as much, then they're more likely to develop an imbalanced pull on the spine, and it can rotate or be pulled into an S-curve from there. Also, as a secondary measure, things like injury recovery. If you have, let's say, a broken ankle or some kind of leg injury and it's causing you to limp, that could impact the positioning of the pelvis, especially if it's over a long term, and you might get a tilting of the pelvis, and as a result you can get a secondary scoliosis, functional scoliosis from that. So consider those things and have the patient recognize or understand at least what they're coming in with, whether it's structural or functional. If it's structural, those things are usually congenital, so people are usually born with that, or they develop over time due to a secondary medical condition such as spina bifida or cerebral palsy or something like that. And in those instances, it's not something that we can really significantly reverse or even halt. The therapies for those are far more significant and invasive than what we can do. With regards to functional scoliosis and the work that we want to do in trying to halt the progression of the curvature and to reverse it, we need to consider a few things. The length of our sessions have to be longer, and the frequency of them has to be greater. We have to do multiple sessions in a week's time, in a week's period, simply because any measure such as bracing that has been shown to have really significant clinical impact on halting and reversing the curvature of functional scoliosis, it's done for many, many hours a day. Some even wear their brace up to 23 hours in the day. So we have to be working for longer periods of time with those people in a shorter amount of time, in a shorter time frame. So consider that and make that part of your treatment plan. If someone's got pretty severe scoliosis, regardless of whether it's functional or structural, you need to think about their breath, because as the case gets more and more severe, the lung function can be influenced, and you just want to make sure that you're not putting too much strain or stress on someone's breathing. So be careful about the positions that you place them in, and you might need to check in with that to ensure that they do have adequate breath moving in and out. Of course, testing the breath out with things like twists over time can add in more movement and mobility into those areas, and that can have a really positive influence on their breathing function and the lung function. But it's not something that we want to test out too much within a single treatment. It's something that we can work on over time. The other thing to think about then is what areas of the spine or what areas of the musculature around the spine do we need to focus on the majority of the work. When it comes to looking at the spine posteriorly, if we have an S-curve, generally, even if there's no rotation, generally the inside of the C, so the concave surfaces, they are generally the areas where there's more tension, and the outer surfaces, so the convex surfaces, are generally the ones that are more lengthened and stretched. So they don't need quite as much work. It'll also generally be reflected in the way that people approach the treatment, and they request more work on one side than the other because they are feeling more discomfort on one side versus the other. So listen to them, they generally know what's going on, and just think about the inside of the C curve generally is the area that we'll spend most of our time trying to relieve the extra tension there and allow a little bit more length and movement. And then in terms of the next steps after the treatment, it's important to think about the exercises that you're providing and suggesting that people do at home. So one of the most important things with rehabilitation or halting the progression of functional scoliosis is keeping the muscles physically active and building strength. One of the easiest things that we can do is cobra pose, like a yoga cobra pose, except lift the hands away and reach them forward. That's one of the best things that is commonly recommended. There are a full spectrum of other back strengthening exercises that you can provide, but usually it's best to start with one or a couple of simple activities that people can complete, and then you can build a more comprehensive remedial exercise program as you continue to work with them over the course of a number of weeks, more regularly in sessions as well. Okay.